The moment when I realized that I needed to change or needed help was whenever I did not know where I was going to stay or where I was going to be. Like I had nowhere to go, and it was no fun. It's not a good time. It wasn't a good time at all.
I knew I had HIV, but there were no medicines, so I said, well, what's the difference? But in '95, I came down with triple pneumonia and was sent to the hospital in what I guess we'd call the HIV ward. I recall hearing crying in and out of my delirium. And afterwards, I asked, what was all that crying about? And they said, those were some of the mothers of the people that didn't make it. So after that, I had to reinvent myself and realize after so many years just sitting there, I'm not dying. I'm surviving. I just have to get up and do something now. Little by little, every day, doing more and more. Finally, got myself up and ready to re-enter the world, and I started volunteering.
I think consumers are a very important part of our HIV care continuum. The idea is they're living through this system, they're experiencing it on a personal level.
Before I became chair, I was actually a consumer of Ryan White, so I've witnessed from being linked to care all the way to the accessing services.
Integrated services are a key part of our planning process. It allows for clients to be able to give information once and not have to duplicate that. It allows for us to be able to leverage funding streams and resources.
We actually have a comprehensive prevention and treatment model that we've done for over years, even on our state level, to where our planning body and also our prevention, which is care and treatment, come together and work together for the benefit of the consumer as a whole person.
Our ACA enrollment, as funded by the REACH Foundation, has really improved our ability to connect clients with care. And our service integration project with the RAND Corporation really allows our housing system and our Ryan White system to work together in the best interest of the client.
When the Housing Task Force first started, our main purpose was to work on integrating data. We had gotten funding through the RAND project, and we really wanted to focus on looking at health outcomes and housing outcomes. When I have openings here in the Restart HOPWA program, I will announce it system-wide to all the KCTGA medical case managers, and they submit their clients in for a lottery. Clients are selected at random through the lottery. We give them a private place to come and to take care of themselves, to take care of their medical needs.
Look, if you're thinking tonight about where you're going to lay your head, chances are you're not thinking about taking your meds, if you even have your meds.
My role as a landlord is to provide quality, safe, and affordable housing to patients diagnosed with the HIV virus.
I started the process with housing through my caseworker at KU Med Center, and he's the one who got me hooked up with SaveInc to receive the housing voucher. Once I got into stable housing, that's when I could actually start working on myself. Instead of having to worry about where I was going to stay, I could actually focus on getting my life in order. And I think it's the best thing anybody could do is get into stable housing. I just recently started college. Without SaveInc and the people that helped me get to where I am now, I don't think I would ever thought about even going.
My role is to help people on their continuum of illness to lead a better quality of life, because they are the living part of the disease. It's the living through it and with it that is the soul of being able to survive it. Kansas City is doing a great job in the two communities, two clinics that have peer educators. We collaborate with our programs. We collaborate with each other. The peers talk to one another.
The Hispanic community, we are on the third most affected ethnicity affected by HIV. But in the Kansas City, Missouri, we are the second one. So continuing the work that I do, it helps to prevent the spread of HIV, one. Second, it helps to actually get the information out. Just coming here to Good Samaritan Project means a means of success. So every day is a success.
As a consumer, it was important for me to be a part of the decision-making process. Just my experience would produce better healthcare outcomes if we know barriers that will potentially compromise members that aren't living with HIV or not aware of. what I like to do, and it's create change. And I'm happy that I can be a part of this team and represent for the patient. We review surveys from the patients and the clients, and what they say is important to the TGA in Kansas City, and so they get it, Kansas City gets it.
Having adequate housing for everyone, especially those living with HIV, is incredibly important. It really provides a service that is invaluable and one that I'm incredibly thankful is available here in Kansas City. That we have a city right now that is really on the move. We're working to connect all of our services in a more efficient manner and making sure that all of us in the city have the same experience as far as livability is concerned. If I could describe Kansas City in one word, I'd say thriving.
I think that one word would be resilience.
I would say it's integrated.
Collaboration.
Perseverance.
Ahead of the game.
If I had one word to describe Kansas City, it would be hope. Hope for the future.
There's plenty of good, strong people. I want to be a part of them. I want to be in that crew. And so that's why I do it.